Bipolar disorder is not only a highly complex condition, but it's also one of the most misdiagnosed mental health issues. This is because it involves components of more common disorders, such as depression. Welcome to Brain Explained. At its core, bipolar disorder is an illness that causes moderate to severe swings in a person's mood. While everyone experiences emotional ups and downs from time to time, bipolar disorder is often strong enough that your ability to function normally is impaired. Check out this video to learn more about bipolar. Bipolar I, the most severe form of bipolar, and involves at least one episode of mania in your lifetime. While this episode is usually extreme and dangerous, you may also experience depression. But you don't have to have a major depressive episode to be diagnosed with bipolar I disorder. So who is at risk for bipolar I disorder? Well, virtually anyone can develop bipolar I disorder. In fact, about 2.5% of the US population suffers from it, which totals about 6 million people. Also, the first symptoms usually appear in the teenage years or early 20s, and it is more common among those with relatives affected by the disorder. So since it appears to be quite common, let's see some of its symptoms. During a manic episode in someone with bipolar I disorder, elevated mood can manifest itself as either euphoria or as irritability. The usual abnormal behavior during manic episodes includes jumping suddenly from one idea to another, pressured and loud speech, increased energy with hyperactivity and a decreased need for sleep, inflated self-image, excessive spending, hypersexuality, substance abuse, and so on. People in manic episodes may spend money far beyond their means, have sex with people they wouldn't otherwise, or pursue grandiose, unrealistic plans. And in severe manic episodes, a person loses touch with reality, during which they become delusional and behave in odd, unusual ways. It's interesting to note that, in the absence of treatment, a manic episode can linger for several days or even months. A depressive episode may then occur. Between episodes, many people with bipolar I disorder go for extended periods of time without experiencing any symptoms. Some people experience rapid cycling symptoms of mania and depression, where they may experience manic or depressive episodes 4 or more times in a year. However, some people also experience mood episodes with mixed features, where they experience both manic and depressive symptoms at the same time, or alternate between the two in the same day. Also, the depressive episodes in bipolar I are similar to regular clinical depression, with depressed mood, loss of pleasure, low energy and activity, feelings of guilt or worthlessness, and thoughts of suicide. But depressive symptoms of bipolar disorder can last weeks or months, but rarely longer than 1 year. So how can this type of bipolar disorder be treated? Well, manic episodes in bipolar disorder require treatment with medications, such as mood stabilizers and antipsychotics, and sometimes sedative hypnotics, which include benzodiazepines. And for depressive episodes, antidepressants are used. Let's look at bipolar II. Unlike bipolar I, it always has depressive episodes with occasional hypomania, which is less severe than mania and doesn't necessarily disrupt daily living. Essentially, to receive a diagnosis of bipolar II disorder, you must have had at least one major depressive episode and at least one hypomanic episode. With bipolar II, it is common that people return to their usual functioning between episodes. But more commonly, those with bipolar II disorder often first seek treatment as a result of their depressive episodes, since hypomanic episodes often feel pleasurable and can even increase performance at work or school. Also, people with bipolar II disorder frequently have other mental illnesses, such as an anxiety disorder, and even substance use disorder, which can worsen symptoms of depression or hypomania. Treatments for bipolar II are similar to those for bipolar I. That is medication and psychotherapy. And while the most commonly used medications are mood stabilizers, antidepressants are used cautiously for the treatment of bipolar-associated depression and continued only for a short time after the depression gets better. This is because they increase the risk of switching depression into hypomania and mania. The third type of bipolar disorder, cyclothymic disorder, is a rare type of bipolar disorder with highs and lows that are usually less severe than those of bipolar I and bipolar II. Yet, it can impact your life just as much. With this type of bipolar disorder, hypomania and depressive symptoms occur more frequently and are more brief. Its symptoms are such that, for at least 2 years, you experience many periods of hypomanic and depressive symptoms. But the symptoms do not meet the criteria for hypomanic or depressive episodes, according to the DSM-5. Or it could be that during the 2-year period, the mood swings have lasted for at least half the time and have never stopped for more than 2 months. Treatment for this disorder involves medication and talk therapy, just like the other types of bipolar disorder. If you enjoyed this video, give it a thumbs up. Thanks for watching.